If you've had vertigo, what tests should you be getting done? How should they be done? When should they be done? And where should they be done? This is a commonly asked question that I get from many of our patients because when they have vertigo, they're not sure where to go, who to see, or what to do. My name is Dr. Gregg Gerstin, and I've been helping people to remove the blockages from their health for the last 20 years to lead amazing, fantastic lives. Now, vertigo is a really challenging condition to wind up managing and figuring out what's causing it. And there are a number of different tests that do need to be done at different times to figure out what's going on. I typically go from conservative to advanced and assess every patient on an individual level, but I find that usually the first thing that needs to be done is a thorough health history to understand where you've come. Then I think there are some in-office tests that a doctor should be able to do before jumping into MRIs and CTs or other tests. These tests can be extremely valuable, but I think that there are a few that you can do to determine if there are any issues with cranial nerves or brain function or motor function to determining what is driving your symptoms of vertigo. When we need to, though, MRIs and CTs of the brain are extremely valuable to make sure that there are no tumors, aneurysms. Multiple sclerosis can be another condition that commonly gets mixed up or causes you to have that sensation, but very infrequently are those what we find is the problem. Most typically what we find is that there are problems within the four systems I usually talk about: the ears, the eyes, the jaw, and the cervical spine. An additional one that one of my patients just came in bringing some of her tests from, and I'm going to read it because it's a nail biter: computerized dynamic posturograph. Now, this is a test where they look to have you stand on a plate and they look to see how much you sway and actually measure it. It's pretty advanced testing, but it's really interesting the outcomes that wind up occurring. Now, this test can be extremely helpful to, once again, set a baseline. But the challenging part about this is when you have vertigo, you probably never have done this before, so you have no idea what you were like before. You know, in the case of this patient, we've worked with her to help her reduce her vertigo significantly and her dizziness. She no longer walks with a cane. She wound up going through this test, and the results were significantly lower than what's considered normal. Now, the challenge with that is that this patient, well, she probably is a bit older and has more sway that's going to wind up happening. So these results might not be as valid as they should be. I find that usually if you can't take those at the beginning and take them later, they might not be the best thing to do. If you're curious what tests you need to have done, write down in the comments. I do my best to answer those questions as quickly as I can to make sure that we're supporting you. If you or someone you know needs help or is having challenges, feel free to hop on a discovery call. We'll put a link to that in the bio down below, and that'll help you to wind up getting through to us. And if you want to know my tips to get out of the spins now, there'll be a link down there for that as well. Once again, my name is Dr. Gregg Gerstin, and thank you for letting me be a part of your health.